Good evening. Welcome everybody to the McHenry County Board of Health regular meeting for March 17th, 2025. The time is 6:31. I'm calling the meeting to order and I ask the clerk to conduct roll call, please.
Ms. Eltroff?
Present.
Ms. Morosky? Here. Dr. Zurich?
Here.
Ms. Carmen?
Here.
Ms. Clark? Ms. Ortiz?
Here.
Dr. Amsler?
Here.
Dr. Katz?
Here.
Mr. Clark?
Here. Item number 2 on the agenda is public comment. Do you have anybody from the public to make comment today? Hearing and seeing none, we'll move on to item 3, public recognition. 3A, proclamation recognizing 20 years of service for Dr. Irfan Hafiz, Medical Director with McHenry County Health Department. I will read the proclamation. Whereas Dr. Irfan Hafiz, MD, has been the tuberculosis medical director for McHenry County Department of Health for the last 20 years. And whereas Dr. Irfan Hafiz, MD, is a licensed physician who is practicing infectious disease expert, and there are not many physicians who specialize in this field within the county. And whereas a TB medical director, or whereas as TB medical director, Dr. Hafiz has treated hundreds of latent and active TB patients who reside in McHenry County over the past 2 decades. And whereas Dr. Hafiz has dedicated much of his career consulting with McHenry County Department of Health to help keep our numbers of active TB cases low and community healthier overall. And whereas as a result of Dr. Hafiz's hard work and dedication, the McHenry County Department of Health is recognizing him for his many trusted years of service. Now therefore be it proclaimed by the McHenry County Board of Health in McHenry County, Illinois, that the members of the board congratulate Dr. Irfan Hafiz, Medical Director, for his outstanding service to our community and honor him for his many years as TB Medical Director. Dated at Woodstock, Illinois, the 17th day of March, 2025.
I am very humbled. Thank you so much. This means a lot to me. Thank you very much.
Thank you for
Thank you.
would you like
Would you like to come up and say a couple of things? Or you don't have to, but I know Renee and Leslie have worked with Dr. Hafiz for many years, and we couldn't be doing the TB program without him.
They do all the work.
Renee's one of our TV nurses.
We couldn't do all the work without you.
On behalf of the TV nurses, we want to say thank you. You've been very patient with us. All our questions, you always make yourself available when we need you. All your help, all your knowledge. I've personally learned so much from you. Thank you.
Thank you. It's been great working with you guys.
Thank you. We miss working with you regularly, but we know that you're kind of going to be on backup for us.
I'm on backup still.
Thank you.
Another physician coming in.
That's going to be great.
How would you like to serve on the board?
Let me know if you need any help. I'm still in the community.
Okay, very good.
Thank you very much, everyone.
More pictures.
A couple more pictures.
You guys should be in too.
With our,
Oh yeah, I'll be great.
With your dad, why not?
it's a special.
I said 3, 2, 1.
Good luck in
Perfect.
something.
Good.
St. Patty's Day, I'm Rouge.
Thank you very much
No,
again.
thank you.
Thank you. Thank you.
Good night.
Good night.
Okay, item 3B, another proclamation for National Public Health Week for 2025. Whereas the week of April 7th through the 13th, 2025 is National Public Health Week, and whereas the goal of the National Public Health Week is to spotlight the achievements of public health and recognize public health professionals' contributions to improving the health of the people of the United States and achieving health equity, and whereas this year's theme is It Starts Here, and whereas during National Public Health Week, we celebrate the accomplishments of the Department of Health and the role our board, staff, volunteers, and community partners play in protecting and promoting the health, safety, and well-being of those who live, learn, work, and play in McHenry County, and whereas the McHenry County Department of Health is the public authority in the county and assists our communities in preventing, preparing for, mitigating, and recovering from the impact of a full range of health threats, including foodborne, waterborne, and vector-borne illnesses, disease outbreaks, vaccine preventable diseases, chronic diseases, and rabies. And whereas this year's theme highlights the collective responsibility of individual organizations and policymakers to create the conditions for everyone to achieve optimal health, emphasizing the power of collaboration and advocacy in addressing public health challenges. And now therefore be it proclaimed by this McHenry County Board of Health in McHenry County, Illinois, that the members of the board recognize and offer their appreciation for the dedication, expertise, and tireless efforts of the McHenry County Department of Health staff, volunteers, and community partners for their contributions in creating a healthy McHenry County for all. Dated at Woodstock, Illinois, the 17th day of March, 2025. Very good. You're welcome. We've got any special plans for that week?
We do, and we'll probably cover.
That
some
will be
of
covered later?
in our
Okay.
plans.
Yes.
All right,
Yes.
very good.
Not to, I don't want to trample on her.
All right, moving on. Item 4 on the agenda is minutes approval for the February 10th.
I make a motion to approve the February 10th, 2025 minutes.
Second.
Second. The motion has been made by Ms. Carmen, second by Ms. Clark. Any questions, comments, corrections? Hearing seeing none. All those in favor say aye.
Aye.
Those opposed say nay. Ayes have it, motion passed. Department and division updates, item 5. Administrator Adamson.
Yes, so I want to start by welcoming Lindsay DeRate over there. She's our new director of nursing. She started at the end of February and she's already hitting the ground running. So I wanted to introduce her and then certainly give everybody the opportunity. We can set up meetings if people want to sit down and pick her brain. I know a couple of people have already expressed wanting to introduce themselves directly to Lindsay. We have been very busy, and I mean, I think we're always busy, but it definitely feels like we have been very busy lately. Couple of great things happening, and I want to give a couple of shout outs. So our fiscal team, Jason and Jenny, have been doing a great job keeping us afloat in the absence of our manager of fiscal operations. They have been working with IT. Justin Bradley, shout out to him too. He has done a great job in setting up our workflow for us in OnBase. He did a training with, I don't know, were there like 25 staff across the department who will be responsible for working in this workflow, and Jason and Jenny have been instrumental in helping to coordinate that with him and work through the process. And so hopefully right now people are still testing that, and hopefully we'll be live in that new process in April. And then we hope to extend that also to grants tracking and implement that And Patty has been doing this a long time in her program, and so it's another great way for us to do records retention and just keep track and have an electronic workflow. We have also been evaluating our medical record system and billing system, and so we've hosted several live demos to get some staff input and try to evaluate if we're going to move in a different direction. Shout out to Mr. Kubiak, who has now left, our PIO, who did an outstanding job on pulling the annual report together, and thanks to all the staff who provided all the data and statistics for that. You'll notice on our administration report that we've had some turnover in February in one of our programs. And just another shout out to all the staff. This particular program's in the nursing division. We've had a lot of staff who have stepped in quickly to assure minimal disruption to the program. So Linda Buck, Fozia Kazi, Jennifer Northern, Janet Villagomez, and Jennifer Rodriguez, and of course Lindsay DeRate. So these are all her staff, and they've done a great job just jumping in and getting to work. I don't know if everybody knows, but Norm, our state's attorney, who has been here long time, many of you have interacted with him, is retiring in early April. So his replacement, Laura Sperry, starts, I guess, right away, and they're going to come to our directors meeting this week and just do kind of a warm handoff so that we can introduce her to all the directors. I will be in Springfield next week for a local health department IDPH convening. This is around workforce transformation. There's been a lot of work at the state level trying to see how do we make, more sustainability or training or, be more effective and efficient as a state as a whole. And those are my general comments, and then the February financials are in the report. If you have any questions, you can just let me know. But we're on track and nothing really unusual to report there.
Where are we in hiring a fiscal manager?
So I'm going to pivot a little bit because I've had some conversations with HR. We did have some applicants. Many of them, by the time we got around to interviewing them, had moved on, and I don't think we just had anyone who just wowed us. So might look at revamping the job description a little bit and see if the requirements that we currently have are what we want to maintain on there.
Okay.
But right now, I think we're able to handle the day in, day out. That's not going to be sustainable over the long haul. So still evaluating that, but working closely with HR to see what else we can do.
Okay. Any questions? Director Noem?
Just a couple of things. So we have been awarded a household hazardous waste event this year by IEPA, so that's a great thing. We should be able to accommodate anywhere from 1,200 to 1,400 participants, and that's going to take place on June 7th at Prairie Ridge High School. So we're excited about that. And then another solid waste project we're working on is, it's called Recycle Coach, and it's actually an independent vendor that through a contract with the IEPA, and it's statewide. And it's intended to enable every single county in the state to have a one-stop shop for all solid waste information. So Kelly Beckman, who is our solid waste manager, is starting out, and so she's partnering with MCC and their Green Guide. The first step will be to enter all that information into the system. It's kind of the what goes where portion of it. After that, then we will enter all of our solid waste events into it and invite any other entity that has solid waste events to put them in there as well. Then we will work with our solid waste franchises and try to get that specific information in there. And the idea is that any resident in the county that wants to know about their solid waste program should be able to go into this and get those details. It also has a function where they can get alerts and things like that. So if leaf pickup is delayed a week, they can be notified, things like that. So it's really kind of a neat thing. And then lastly, we'll start to partner with our municipalities and try to get them to give us that information as well, work with them. So ultimately, to have a really nice site where people can go and get that information, and then it also allows us to get some data out of it, and we should be able to have some solid waste metrics and things like that, which will be very, very nice. So we're excited. So.
Is that coming from the grant money that we received, or?
No,
No?
and that's a little bit on hold given,
Yeah, I was
different
curious.
grant statuses, although the mayor's caucus is still moving forward with the plans for it as if, the money will come through, so that's still
Okay.
moving forward. No, this is actually, was a grant that the IEPA received,
Okay.
and then they made it available to every county in the state.
Oh, that's awesome. Yeah, because I saw that King County had theirs, so.
Yes, they're
Yeah.
working on theirs, right,
Yeah.
exactly, so. That's all I have, thank you.
Oh,
Any-
I just have one question. Well, I just have one, kind of, I've had a few residents tell me that that when they want to use their own coffee mug at certain places, they keep being told that the health department won't allow that. And I don't think that's true because I know I use my reusable, I hand mine in at many different restaurants coffee shops, but it
Yeah,
seems like
and you know what, last year, there was a whole, law change that was to allow people to bring in containers that could be refilled, kind of to get what you're talking about, to reduce that reliance on single-use containers. And so I'm gonna research that for you, exactly what the requirements are, but yeah, my understanding would be the same, that a container could be brought in to be filled and
Yeah,
used.
okay, all right, yeah,
But it
that'd
would
be
be
great.
your container specifically and, your drink, yeah.
Right, yeah, perfect. All right, thank you.
Yeah.
Any other questions from the board? Thank you. Nice report. Director Howell, please.
Thank you. A few things I wanted to update you on. So we have continued to see an increase in requests for relinquished animals. With that, though, we're also seeing an increase in unclaimed owned animals. So we know who the owner is, but they're choosing not to reclaim. And we're seeing a continued, obviously, because we have so many requests for relinquishment, an uptake in our relinquishing. So we're okay here today, but Friday, we have intake animals, if you've been to the facility, and adoption animals. Because we had more intake, we had some animals that could go up for adoption, but couldn't be moved over to the adoption side. Because we've seen this increase, we also see that need for more spay and neuters or more check-ins. A check-in is when the vet gives the animal the rabies vaccine. So we're kind of getting, I would say, a little bit behind in getting those through the flow because we just don't have enough surgery spots to get those done. So I'm keeping an eye on it. We are doing, if you notice in the stats, we're continuing to do more transfers. But now, my second thing on my list is that we do have some surrounding counties who are struggling with staffing. So we have been very fortunate. I don't have any good wood to knock on right now, but we haven't really lost too many. And when we've lost them, we've been able to fill them. We have one open one right now. But surrounding counties are losing people and having a hard time filling them. I do think going through the CPQ process and raising those grades helped us. We've been able to get in professional staff, we've been able to maintain them, hopefully we'll continue to be able to maintain them, but I'm keeping an eye on it, so I want to make sure you know that. We have another county who may need some assistance. They've kind of put it out there that they're low on staffing, so we may have some contracts where we're helping those around us. We will have our off-site clinics in April, May, and June. You didn't see the contract, there's no cost to it, but I haven't seen the contract yet. So I keep asking, we're going to be doing it at the fairgrounds. They're doing it at no cost, but I need to get that contract in to get signed so we can get those set up. So as soon as we have that contract and we get it signed, then we'll be able to put those out in the media. Let's see.
What services will we provide?
We do the rabies vaccine and we do microchipping. We don't do other vaccines at those right now. Yeah. But we continue to fill up. So I imagine that we'll see that as well.
It's by appointment.
It is by appointment because we have so many slots. So dogs are one day, cats are a different day, and then dogs and cats are the third day. We typically have 2 days of dogs. If we have some space left, we'll fill up cats at the end of that day. So we'll see how it goes. And you'll see the media press release as soon as we get that contract. And then the only other thing we're seeing is a little bit of return from adoption, a little bit more than we'd like. But I think that is somewhat just society, the community right now, where you want that companionship, but maybe it just doesn't turn out the way you think it's gonna be. So we work on it, we try to work with people after they adopt to make sure we can help them find resources to keep that animal, but it just doesn't happen sometimes. So keep you sort of, I think that's a national and a regional trend. That's all I have.
Any questions? Mary Ellen, if our surgery is running tight, any chance that if we're then cooperating with other counties, with staff for on-site calls and such, any chance we can get some cooperation in using some of their surgery facilities?
So that's a very good question. We actually, I forgot to add this into what I said, we are using one of the outside vets to do some of our surgeries right now. So we do have another avenue. It's just a matter of them having openings as well. Now, the counties surrounding us, some of them don't have adoption centers. And then some of them don't do on-site surgeries.
Okay.
So the two counties in particular, one doesn't have an adoption center and one doesn't do on-site surgeries.
Okay.
So, but we do have that outside vet that we are using when we can.
Okay, very good, thank you.
Yeah.
Good report. Director Marin?
Thank you. So for Public Health Week, Wednesday, April 9th, we are having an all-staff meeting. It is going to be held at the McHenry VFW. We wanted to get everybody off-site so that we're all together and do some team building. We have a speaker and a facilitator for a workshop called Scaling Minds. It's going to incorporate morale, trust, team building, strengthening relationships within kind of what everybody's been through. There are going to be some interactive activities as well. The VFW was kind enough to let us use the venue for free, so we really appreciate that and thank them very much. We are looking to finalize our menu and what we're going to have for that luncheon. So it'll be a half day from noon to 4:30 and a lot of interactive really good things. So we're very excited about that. Moving forward with training, we're working very closely with MCC. There's a DDI workshop, which is for management and leadership studies that we are looking at that we're going to begin to send people to as well. It'll help, reduce conflict because a lot of people have asked for, conflict management, especially our front-facing people that are dealing with some angry public on a daily basis. We want to make sure they have some coping mechanisms and some training in that. And basically, kind of fostering productivity, creativity as well. So we're excited to start that series that begins in April and runs through June. On another note, for Building A, we have Century Security coming in. We're signing the contracts for the new security system. The one they have is currently very, very antiquated, and it's kind of up and down. So by the end of the month, we're hoping to have that in and done and operational. And Crystal Lake update. Staff went 2 weeks ago and picked out colors and finishings for the building. So that was exciting. It was kind of an HGTV moment, if you will. And we are meeting on Thursday for a pre-construction meeting with Stuckey and the other contractors. We will then get the schedule for the construction activities and be able to work very closely with them, scheduling weekly meetings and safety meetings. First and foremost, we will have employees there and live animals, so we want them all to make sure that they are cognizant and safe about that. So we will definitely by April be able to get you a schedule of construction and hopefully when our timing is and when it will be completed. The strategic plan update is under the report section in your packet, so if anybody has any questions, feel free to either call me or email me or see me, and I can answer any questions on that.
Questions or comments from the board? In regards to the strategic plan report, very detailed, well done.
Thank you, thank you. Everyone's been working very hard, so I'm proud of everybody doing their thing.
Good job. Director Heck?
So for those of you that don't know, we've always done CPR classes for our MCDH nursing staff. So we, like 2 years ago, we expanded that at the request of risk management to also offer it to county employees. So we've been providing those classes to them. So now we're thinking about, we're just in the infant stages of planning to provide it to the public too. So we currently have 4 MRC volunteers that are trained to teach the classes. And we had 2 staff, but one retired. So we do have 2 more staff going through the CPR instructor training next month. So we will have 3 staff and then 4 MRC volunteers. So that's our plan in the future. For those of you that didn't see the press release, Operation Dropbox has kicked off. So in just a week, we already have 45 sites signed up. Last year, I think it was close to 90. And this year, at the request of Bridget and I think we're gonna expand it to like a 2-day event because it was so large last year. We're just gonna try and split that up because it was really exhausting for the volunteers and for staff. We really kind of want to minimize that a little bit. But hopefully I'll let you know at the next meeting how many sites we have this year. The community gets really excited about this event. And then last thing I was just gonna bring up is that last week we participated, our ER program, along with the MCDH leadership and EMA and IT in a tabletop exercise around cybersecurity. So that's the #1 threat to the county, for those of you that didn't know that. So then we completed that exercise. I think it went really well. We had some lessons learned and things that we can work on in the future.
Questions, comments from the board? Thank you. Director DeRee?
Hi.
Hi.
I will be rather brief as I continue to get up and running. Generally speaking, I've been meeting one-on-one with all of the staff. I'm still finishing that up before our first meeting all together. So it's been keeping me busy, and then meeting with the directors and working through all of the things that are going on. From the epidemiology team, I just have that the seasonal respiratory infections are coming down, which is positive. That's a positive trend for us. And yeah, does anybody have any questions?
As this is your first presentation to the
Yeah.
board, can you tell us about yourself a little bit?
Sure. My background is I was in the military and I worked in nutrition and dietetics, and then I got out and became a nurse, and I worked in medical oncology, and I worked with youth in care, both on a personal basis in fostering, and then also as a court-appointed special advocate, which is how I ended up in moving towards my master's in public health, and I worked as an intern here on the Mobile Health Clinic initiative, and then further, that's how I transitioned my experience with foster care, moved me into the position that I was working in youth case management, so with all of the youth in care and helping their families navigate the medical professionals and providers and records and such. So I've been doing that, and then I transitioned to this. So very exciting and wonderful opportunity. I'm really excited to be here and taking part in being part of an amazing group of people to make a difference in our community. So thank you.
Welcome.
Welcome aboard.
Thank you. Happy to have you.
Any questions? All right, thanks. Dr. Tomaso, do you have anything?
I'll be speaking on the vote
Later?
later.
Yeah.
Ready to
Okay.
raise your hand. Okay. Yeah, that works? Okay.
Very good. All right. Moving on to item 6, the consent agenda. Does any board member want to have an item removed from the consent agenda? None, we will take a motion.
I move to approve the consent agenda.
Second.
Who's second?
Lupe.
Lupe, okay. A motion has been made by Ms. Gaffney, seconded by Ms. Ortiz, to approve the consent agenda as presented. Any discussion from the board? None. As this is a monetary issue, we'll do a roll call vote, please.
Ms. Gaffney?
Yes.
Ms. Ortiz?
Yes.
Ms. Borowski?
Yes.
Ms. Clark?
Yes.
Dr. Katz?
Yes.
Dr. Amsler?
Yes.
Ms. Eltoff?
Yes.
Dr. Zurich?
Yes.
Mr. Clark?
Yes. Motion passed. Next item is contracts and new agreements. 7A.
So this is for our community health assessment. That's coming up in 2026, so I'll turn it over to Megan to make any specific comments. So the vendor that was chosen was Metopio, which works very well because they're also our vendor for our Health Atlas that stores all our secondary data. Metopio was by far the lowest bidder by far. So we were really excited about that, that they can complete all this for us for that cost. Because the last time we had this done was in 2021, and I think the total was almost 50,000. So this is a huge savings for us. This cost will be split with community partners that we partner with. So there's a couple hospital systems, the mental health board, and then a new partner this year is the McHenry County Community Foundation. So we're excited to have them on board. So Metopia will be doing our community survey, 3 focus groups, a key informant survey for us, and then they're going to compile that all into a report and then pull it all together. So the whole scope of it.
And just as a reminder, the community health assessment and improvement plan is part of being a certified local health department. It is a requirement.
Does the board member wish to be recognized?
Make a motion to approve.
No, they thought we were, no, she just couldn't find that.
Metopio contract.
Who's going to second?
I'll second.
A motion has been made by Ms. Carmen, second by Ms. Katz, to approve the contract for
Okay. It's
Metopio.
actually Miss Gaffey, but, you know.
Oh, sorry. Should I correct that? I'll correct that. Motion's been made by
We all
Ms.
look alike.
Katz, seconded by
Well,
Ms. Katz, to approve the contract for Metopio. Any questions or comments from the board? As this does have a monetary value, we will do a roll call vote.
Ms. Gaffney?
Yes.
Dr. Katz?
Yes.
Ms. Clark?
Yes.
Dr. Zurich?
Yes.
Dr. Amsler?
Yes.
Ms. Ortiz?
Yes.
Ms. Morowski?
Yes.
Ms. Altop?
Yes.
Mr. Clark?
Yes.
It's different sitting
And
this
Ms.
far
Carmen.
back away.
And Mrs. Carmen.
Different perspectives.
It's okay.
The motion passed. Next item is 7B, TB Medical Director, Independent Contractor, Dr. Ahid Saeed Ahmed.
Yes, so this is the contract that will replace Dr. Hafiz. We've been working all together, so the transition date was selected to be April. As mentioned, I think Leslie or somebody made a comment when she was still here that he will continue to be our backup TB. So that's great because in some cases, when we're reliant on one person and that person is out of town, it can make things a little challenging. So this is great that the team at Northwestern Medicine is going to be working with us, and they've been great. They made this a very smooth and easy transition for us, and essentially the terms of the agreement are the same as under Dr. Huff.
Board member wish to be recognized.
I make a. Would you like to do it?
No, you go for it. Go for it.
She's gonna get recognition.
I'll second
Okay.
Yay.
A motion has been made by Ms. Gaffney, seconded by Dr. Zurich, to approve the contract with Dr. Ahmed. As this is, any comments or questions from the board? You're seeing none? Is this as a monetary component? Again, we will do a roll call vote.
Ms. Gaffney?
Yes.
Dr. Zurich?
Yes.
Ms. Altop?
Yes.
Ms. Morowski?
Yes.
Ms. Carmen?
Yes.
Ms. Clark?
Yes.
Ms. Ortiz?
Yes.
Dr. Amsler?
Yes.
Mr. Clark?
Yes. Motion carries. Item 8 is program highlights, 2024 opioid overdose trends. Ms. Gasson.
Yes, so
Laura Gossin is here with us. She's one of our epidemiologists. She works under Ryan Sachs, who's our coordinator of that program. So if you recall a few 3 months ago, I think, topic came up. We decided to come back with more information. So Laura does track all this information. And so I'm going to turn it over to her. And magically, do you want me to change your slides?
No, I can do it.
Okay.
If I can click through it, that's
Okay.
Let's take her seat. Hi. So it feels weird to be sitting here. Hello.
Welcome.
Hi. So as was said, my name is Maura Gosen. I'm one of the epidemiologists here. I do a lot of the behavioral health stuff. That's my primary focus. We do a little bit of everything. So today I'll be talking about the 2024 opioid overdose trends here in McHenry County. Doesn't want to. There we go. Okay. So this is a bit of an overview. We at MCDH do regular surveillance. So our 4 data sources we always track are emergency department or ED visits, EMS encounters, overdose mortality data from the coroner's office, and we track Illinois Poison Center calls when there are opioid exposures reported. So I'll be going over trends over time, along with disparities and demographic differences among all of these, and then also go over some top substances that are reported among the causes of death, and then substances that are reported to Illinois Poison Center. So to start, here are the trend in accidental opioid overdose ED visits by year. We don't have any data prior to 2022 at this time because we changed our methodology and how we go about classifying overdoses. So we can't compare prior to 2022 because we changed it up. So we look at ED visits and we classify them based on their chief complaint, discharge diagnoses, and triage notes for each case to make sure that they were in fact due to opioids. So as you can see that overall decreasing from 2022 to 2024, and 2024 was about 42% lower the number of overdoses in 2023. This is all ED visits among McHenry County residents, regardless of which hospital they went to. So these could be hospitals in Chicago, but if your primary residence was in McHenry County, they're counted here. So it's all hospitals in the state of Illinois, but if somebody got care outside of Illinois, then they're not included here. So this is just Illinois hospitals. Here we can see opioid overdose EMS encounters from 2020 to 2024. So you can see it increased from 2020 up to 2022, and then started to go down, and then there's a pretty big decrease from 23 to 24. So you can say it was 38% lower in 2024 compared to 2023. And this is anytime an EMS is called and naloxone is given on the scene. And the individual was determined to have an overdose. Off the top of my head, I can't remember what exactly. I know there's like 4 or 5 different indicators that they have to cue in to know that it was in fact an opioid overdose and Narcan was given. I can't think of what they are off the top of my head, but I do know that they were opioid overdoses where naloxone was given. This includes both residents and non-residents in McHenry County, as long as the encounter occurred within the county borders. Here we can see accidental opioid overdose mortality by year from 2020 to 2024. This is a pretty steady overall decline. From 23 to 24, there was a 30% decrease. So in 2023, there were 30 accidental opioid overdose deaths, and then in 2024, there were 21. This data is provided by the McHenry County Coroner's Office, and it's based on if the causes of death include an opioid, and then the manner of death was deemed to be accidental. So this doesn't include any suicides or intentional overdoses, and it's also just opioids. Any other substances isn't included. Excuse me. Our last data source is opioid exposures reported to IPC, or Illinois Poisons Control. You can see there's a pretty big decline from 2020 to 2021, and then it stayed pretty steady There was a slight increase from 2023 to 2024, about 31%. However, it went from 16 to 21, so it's still, 21 is still pretty level with what we've been seeing the past 4 years. So now I'll be going over some health disparities and demographic data. We also have zip code data for some of these, so I'll be able to share that. Our poison control data doesn't have any demographics, so I won't be showing any of that, but I will show the other ones. So the individuals in McHenry County with the greatest rates per 100,000 population among overdose ED visits, accidental opioid overdose mortalities, the deaths, and then also EMS encounters were the highest rates were in men versus women. Highest rates among those were 30 to 39, and then it's highest among those who are non-Hispanic Black. Again, these are rates so that we can compare between the groups. If we just do a full count, we're not taking into account the amount in the population. So in all three of those data sources, there were at least 2 times more men than women who overdosed. So that's deaths, ED visits, and EMS encounters. And last year, there was a shift, a slight shift in the age groups in ED visits and the deaths, so that there were slightly more younger people. So it was a slight increase in those between the ages of 20 to 29. Because of our suppression rules, we can't share any data of any raw values under 10. So the charts don't really show much, which is why I have this nice little summary here, because otherwise we'd be looking at like 1 bar. So I can't show that the 20 to 29 had a big increase, but there was one. The highest burden and disparity is still among those who are 30 to 39, so the highest count and rate is still that group, but there is that shift among younger people. Relating to the rates versus counts, those with the highest rates, the highest disparity is among those who identify as non-Hispanic Black. But when we look at the count, those with the greatest number, the highest burden of overdoses, are those who are non-Hispanic White, but that matches the population of the county, so it's not super surprising. But just want to make sure to point that out. And here, a little hard to see with the light, but is accidental opioid overdose ED visits by zip code. So this is the patient's primary residence zip code, not where they overdosed. But from 23 to 2024, you can see that there's the darker chunk up in that northeastern quadrant. Because the darker areas show where there's a higher rate per 100,000 of overdoses. We're not sure why there's that shift from 23 to 24, but showing maps like this does really help with our prevention and response initiatives, so we know where we should be targeting our outreach. So this has been really helpful to have, that we know we have to get up into that way up there zip code, and right now I'm nervous, so I can't think of what towns are up there, but
7-3, that's what?
Is that
Harvard, Richmond, right?
the 60071. I don't know what that is.
That might be Richmond.
Spring Grove.
Or John.
Thank you.
Well, Spring Grove is, so, but it's, yeah, that Richmond up in that area next to the state line.
Like I know there's definitely, you've got the McHenry zip codes, Wonder Lake, and then that one up there that I'm blanking on what that is, but
60071 is Richmond, Spring Grove, and Belden.
thank you.
According to Google.
So, yeah, they have the highest rates per 100,000, incidence rate per 100,000 in 2024 of overdose ED visits. And then when we look at EMS encounters, this is where the individual overdosed, so it's where the encounter occurred. So we can see that the rate shifts a little bit, and that highest rate is actually down in Marengo.
Really?
It takes into account the population. So if there are more overdoses, but that smaller population, the rate's gonna be bigger.
Oh, okay.
So this is how you can compare evenly. So if there's 100,000 people in each zip code, most of them, there'd be higher amount in like that Marengo area. So that's how that kind of works out.
So the dark green is the most, that
Yeah.
middle shade of green is the middle, and that light green is
Yeah, and it doesn't, the ones that don't have any color didn't have any that year.
Okay.
I can't get it to show up so it's like white or something.
Yeah.
So that's just so if it's just completely grayed out, that just means there weren't any. So that's why some of these are blacked out. But yeah, the darker colors are worse. And then for deaths, this is again where the individual who passed away. So where the overdose likely occurred, you can see that shift from 23 to 24, and that this one there was fewer in Marengo and it moved up, so it kind of matches where our ED visits
their residences. You can see, I'm gonna flip back and forth between them. I wanna point out that Wonder Lake, that 60097, is a dark green in all 3 of our data sets, indicating that we should probably be doing some more outreach in that area. It's just harder because we don't have really good places to like do pop-ups and do kind of an outreach. So if anybody has suggestions, you can come to me or Megan, and we can get it to our prevention and response team, because that, as you can see, it's the dark green. They're having an issue. We just don't really have good spots to set up any outreach.
Laundromat, it's always a good spot.
Laundromats are always good, and I don't know Wonder Lake super well.
Is that really true, laundromats?
You're sitting there for hours, yeah. We used to do voter registration through there. You got nothing. I mean, this is before cell phones and stuff. Yeah. Yeah. Oh, yeah. Laundromats were fun before cell phones. You would get in great conversation.
So that's where it should have been hanging.
And then I'm going to go over some top substances are reported. So we get substance level data from, like I said, Illinois Poison Center, what substances were exposed to. And then also I'll be talking about cause of death data from the coroner's office. So to start, you can see that there were 21 total calls to IPC in 2024. One of them was for methadone, 4 for tramadol, and then the other 16 indicated polysubstance use. If you want to see the full list of what polysubstance refers to in 2024, it is in our opioid report. It would have taken up like the whole slide, but it ranges anywhere from over-the-counter medications like Tylenol and Benadryl to methamphetamine and heroin, and so it's a pretty big range of substances that are always included in there. But at least one of them was an opioid to be counted in our numbers here.
So who's reporting to the IPC?
So this can be either individuals who call, but most of the time it is facilities. So whether or not it's a healthcare facility or like a long-term care facility, they can call in, and then that gets counted into this as well. In terms of mortality data, over half of all substance-related deaths were caused by fentanyl in 2024. Other common substances includes opioids, including oxycodone and tramadol, which are also known as Oxycontin, Percocet, and then tramadol is Conzip or Ultram. And then the next highest would be stimulants like cocaine. Cocaine is a pretty big one in our area. And then followed by depressants such as alcohol, alprazolam or Xanax, and then clonazepam or Klonopin. So those are our big causes of death. And this is just, these weren't like the only cause of death. A lot of them have inner things mixed into it, but these are the ones that we see most when we're going through listing them all. So in response,
does cocaine include like crack cocaine and?
Yeah.
Okay.
Yeah, it's all forms of.
Okay.
A lot of times when they list the cause of death, it just says cocaine. They don't always specify. It just kind of depends.
And like meth? No, meth is separate.
That's separate, yeah.
Sorry,
No,
as
you're
I said
good.
it, I was like.
And then in response to all these overdoses, I just wanted to point out that in 2024, our overdose prevention and response team handed out over 1,700 fentanyl test strips and almost 2,500 boxes of Narcan or naloxone, which have 2 doses each. That is amazing. They're doing really great work. And we can't say specifically what has caused that decrease that we've been seeing in deaths, overdoses, and EMS encounters and ED visits from 23 to 24. But we are pretty confident in saying that it is all the harm reduction that has been done by MCDH and also all of our partner agencies that do great work getting supplies out to the community and getting the word out on how to prevent overdoses. So just want to give a little shout out to why we think the numbers are going down. There's no statistical evidence on that yet, hopefully, but we're still pretty confident. All the data that I just presented, hopefully an infographic will be out by the end of the week. It may or may not actually look like this. I have to get it fully approved, but hopefully only colors and things shift because so far it's so good. So hopefully this will go out on our website. So it's a little easier to digest than our multi-page report that we put out. Speaking of the report, there's also going to be a shift in how that's going to look. It's going to look more like our respiratory reports that come out. So we're trying to get it a little more standardized across all of our EPI things. They're not all looking different. So there should hopefully look a little bit more, a little similar. And finally, you can see all the data on the Health Atlas, because everything I mentioned is available there to view. And then all other behavioral health data is there, and there's more information and data on all the prevention and response activities that happen, and all the clusters that we identify and stuff are also available on the Atlas to look at. And that's all I had, so thank you all for having me. Does anybody have any questions for me?
It was quite impressive seeing the drop in incidents. If we can get it to drop that much
We can
again.
keep going, right,
that'd be
yeah.
Even better. Is there anything you need from the board?
A site in Wonder Lake.
Yeah, things, resources in Wonder Lake, but.
What kind of pop-up place do you need in Wonder Lake?
So right now, they go to, there's a gas station, and I cannot think of what it is, that I know they've worked at, and they're looking at getting into, or outside of like liquor stores. But it depends, if some places are a little less willing to have Narcan and things outside their facility, which I understand, kind of. So it is harder. I know Julia is part of our work group meetings. She's there all the time. You've heard it, all of our issues trying to get places. So yeah, just wherever we can get in.
Did the pantry ever say yes to having a pop-up there? Because I know the food pantry was pretty interested at one point.
We did have pop-ups there before, and then there was, I'm not sure why that stopped, but there was a reason. I should look into having Marissa check again.
Yeah.
Because we haven't had a pop-up there.
What's the pop, is it like a trailer? Like how do you?
So it's basically a tabling event.
Oh, okay.
Tabling where they hand out Narcan and test strips. And now we do have xylazine test strips as well that we can hand out, along with the pill bottle, like locks, and medication disposal that I think Marissa and the team takes along with, right? Okay. Just verify that they bring that along.
I had an idea. I don't know if this would be possible, but I was just thinking, okay, what do these people gotta do? Everyone's gotta eat. So if it's possible, like for like on like Uber Eats or DoorDash, that like at a local restaurants around that area, you could add Narcan to it. And then the driver could, with bringing you a McDonald's, your cheeseburger, could bring you Narcan as well, you know, for just to have.
Yeah.
You know, if that's a possibility.
To look into how to do that.
Yeah, it would just have to be like on that restaurant's, you know, order,
Right.
if that could be a possibility. And then, okay, great, now now you'll have, you know, especially if.
Food and Narcan.
Food, yeah. Well, I was thinking if like mom doesn't want the kid to see it or whatever, you know, that's way it could be brought to the house without,
We have to
without,
do
you know,
a
kind of
restaurant.
confidentially, I don't know.
Okay.
I don't know if it's, just an idea.
The delivery of that, that's what I'm saying.
What about like Uber? Like aren't people getting home from places or, I don't know, I know transportation's an issue anyway, but I just.
Uber drivers?
Yeah, like if they're coming home from.
The issue is that they're independent. And so you're now talking about liability issues, blah, 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 blah. I think it's a great idea. I just see it may not be as easy to implement as you think it is.
And I also don't know if like Uber, the company themselves, have any laws or rules against that. We'd have to.
Yeah.
That would be an issue too.
I think also, you know, not underestimating District 156 and District 200. The youth in there are going, you know, at least high school students are both coming from both those school districts. I do see a lot of youth from District 156 and teachers.
The vending machines are our vending machines are Harvard, McHenry, Crystal Lake. There's 2 in Crystal Lake. And now I know that there are vending machine, I don't know if they're vending machines or they're just boxes, are at both the Advocate hospitals, and then I believe Northwestern is working on it if they don't have them yet for all their EDs.
I don't know if we could get one into Wonder Lake.
It just needs a physical location.
Megan has it, just not to.
Dollar General.
But she may have some additional
There you go.
items, because these programs cross over.
Yeah.
Quite a bit, yeah.
Facilitator is under Megan's program.
Marissa is our substance use facilitator, and she works really closely with Maura. They do an awesome job. But we did receive, under our comprehensive health local, I don't know, what it's called now, some opioid funds. So one of the things that we did with that is that we had coasters made, so Marissa's gonna start working with the bars. So the coasters, although, and she will allow, you know, if they request Narcan there, she can have it there, but at least have the coasters where they can get Narcan, where, you know, it just has some information on them. So she will be starting to work with the bars too, to get that in there. And then we do have a vending machine that we are moving that we need to find a location for. So that is something that we will look up in that area. But it is, there's not as many places up there that are places that we can go, but we're trying.
I think there's a liquor store, Sunrise Liquors, not that I don't drink, but I pass by it. And there's Dollar General.
Yeah, so we'll continue to research that.
Yeah.
Marissa's doing an awesome job.
Or at the beach. I don't know if there's beach parties. I don't know. I don't really go to Wonder Lake, but Live for Lotley maybe could do a mobile stop at like their beach on like a busy holiday.
Yeah, we should bring that up, so that's a good idea.
You know, it's interesting, on the 708 org website, and they have a searchable feature where you can look for resources by location, and there's nothing listed for Wonder Lake, like not even any behavioral health organizations that are identified in that area on the site.
Yeah, the resources there are great. So we will do our best to get in there.
In some of your paperwork, I was looking to find it again. We had this discussion before you gave your presentation. It talked about a non-opioid drug that got a positive response from Narcan. And we were trying to figure out what that drug would be.
So there wouldn't be. I'm trying to think of what you might have seen, because Narcan only responds to opioids, so it blocks that receptor that's in your brain. It's not going to affect anything else. We do have in our stats, it's like opioid with a suspected other drug with opioid, and part of our clusters. So if we know that there are individuals who said they were using cocaine and then they either passed away or Narcan was able to revive them successfully, we know that there was some sort of opioid mixed into there, whether or not they were trying to do that and they forgot, or it was placed or whatever. So I think that might be what you're referring to, because no, Narcan will only work on opioids. Yeah.
Well, that's what we were trying to figure out.
Yeah, yeah.
Is there another drug
nope.
that Narcan would work on? And the answer is no.
The answer is no, yeah. Yeah, that's correct. Now, we have some of our stats are other drugs with opioids, suspect opioids. That might be what you've seen. So.
Any further questions or comments? Excellent report.
Thank you. Thank you so much.
Item 9 on the agenda, new and unfinished business. 9A, review and approval of the McHenry County Department of Health annual report. In your packet is the report for 2024. All of our employees' hard work, and the results are posted.
It's a lovely document.
Well done.
It is. It really, I mean, I think this usually is good.
We do need to approve the annual report. Is there a board member who wants to be recognized?
I make a motion to approve the annual report.
I'll second.
Motion's been made by Ms. Carmen, seconded by Dr. Amsler, to approve the annual report. We can do a voice vote on this, so any questions or comments?
To what?
Questions or comments?
No, it's all good.
Everybody good? Okay. All those in favor, say aye.
Aye.
Those opposed, say nay. Ayes have it, motion passed. Each board member will receive a hard copy of the,
Yeah, we'll put it to print now.
okay, thank you. Item 10, board issues. 10A, personnel policy section 2.1, vaccination and tuberculosis screening requirements.
So I can, I know it's under board issues, but
No,
did you
I'll-
want to kick it off? Or you want to-
It was brought to my attention that there's been some conversation about the language in the policy for vaccinations, tuberculosis screening, et cetera. Recalling that this was last amended and during the onset of COVID and when the pandemic was at its most life-threatening point, we began, or we created this language, and it's been in place ever since. When the conversation was called to my attention, I reached out to Administrator Adamson and asked that she review with staff to see if there is any reason to revisit the specific language. So I'll turn that over to you.
So we met last week, including Dr. Tomaso and the Director of Nursing, the Assistant Director of Nursing. We had other staff in there to review our requirements because we have quite a few vaccination requirements that have been on the books for a long time. Prior to COVID, we had added flu, and then when COVID hit, we added COVID. But preceding that, there were already other requirements depending on your role in the organization. So we reviewed them with Dr. Tomaso, and so I'd like to kick it over to her to summarize what we discussed.
Basically what we found is that for healthcare workers, there's still, early in the pandemic, it was required to mostly that you receive the initial series of the 2 shots or 1 shot, depending on the manufacturer of the COVID vaccine. It's now become mixed as far as whether they're requiring the annual booster shot. So this is for COVID. As far as flu shot and then the traditional other shots, MMR, varicella, hepatitis B, Tdap, those are still universally required for all healthcare workers and then many other public workers in general. So it's unanimous that we all still continue to require the flu shot and then all those other shots that I just listed. As far as the COVID shot, since it's mixed, that was more of the discussion. So that is, we did decide that we felt we did want to continue to require that as an annual booster. Basically, the COVID numbers still continue to go on. It's not a reported illness any longer, which is similar to the flu. Every single case of the flu is not reported. Novel strains of COVID are reported, just like novel cases of the flu are. It's more of a spread out incidence pattern versus the flu, which is seasonal. And then as a frontline respiratory illness worker myself, I see it all the time, every day in practice. So people that are acutely ill with it, especially people with, that already do have lung cardiac diseases and the very young and very old. There are hospitalizations still going on. Yes, it's, nowhere near to the, degree of fatality and morbidity that it was at the beginning. But I believe, and, I think many clinicians will tell you that this is due to the vaccine and the ongoing widespread vaccination of the vaccine. And feel that the reason that there is so many mixed requirements for workers versus getting the flu shot and all the other long required vaccines is because of the politicization of COVID and because of the fear of the mRNA aspect of the vaccine. People feel that it, because of the DNA implications of it, that it could somehow alter your DNA, which is physiologically impossible. mRNA does not whatsoever enter the nucleus of the cell and cannot touch your own DNA. So that's absolutely false. And I think those were my main points. Are there any questions about what I discussed? Yeah.
So I'm not a healthcare professional. I'm going to make an assumption that most healthcare professionals understand that there are vaccines that they need to take to ensure their own safety when they deal with patients. Are you getting any pushback at all from any of our employees about the requirement of having a vaccination for COVID?
I'm not going to say the answer is no. We offer a medical exemption and a religious exemption that is required. If we didn't have it, I couldn't tell you, if we would have full uptake or not. It's mixed. Some health departments still are requiring it. Some are just highly recommending it. But I think, we had a long discussion. We continue to believe it helps protect our workforce. It protects the people we interact with. We're interacting with children. We're interacting with potentially vulnerable populations. And so there's an economic, case to be made, I think, on the workforce side, that we want to keep people healthy so that our operations continue. But whether or not we would get a ton of pushback, I can't really answer that. I think there are many people who would continue to want to get the vaccine and protect themselves. But if we don't, is it just COVID that we're talking about? Flu, we continue to have these requirements for a reason. Yeah. I don't know if that answers
I'm
your
making that
question.
assumption.
Yeah.
I just wondered if there was a large outcry that, we would continue to require COVID vaccines specifically. That's
Well, people complied, because that is the requirement.
We only have 7 people that have come forward with either medical or religious.
Combined, yeah.
Thank you, I
So
appreciate
out
that.
of 110.
Right.
Sorry, you
And
meant
the
current
exemptions
versus
that,
future.
I review all the medical exemptions. The religious exemptions are reviewed elsewhere. And the medical exemptions that I get are, for the most part, acceptable. Some of them, and it's hard to say no, but.
But that was the answer I was looking for.
Yeah,
I mean,
they're
7 out
out
of
of-
135
Yeah.
is not.
No, people are not going out of their way to try to get the exemptions, yeah.
Thank you, that's all. Thank you.
The booster shot is provided by the health department.
We have been providing the shots annually. It is more expensive than it was in the past, but we have continued to do that.
Okay, so it's no expense to the employee.
At this time, no. I mean, that may be something that we have to explore in the future, but right now, no, there is no cost to the employee. Most people who are on county health insurance, I think it would be covered by insurance.
Is there any ongoing testing that takes place?
We are not doing any ongoing testing. We do have provisions in the policy that if, to follow the CDC recommendations, and that we could impose masking or something else on someone who, reveals that they have tested positive. But obviously, we have time off. We encourage people to stay home when they're sick, and we would encourage them to get tested, but most people were not doing that testing for employees anymore.
Okay.
People are testing at home or going to see their physician.
If an employee disclosed that they did test positive at home, is there any period of time where they cannot come back to work?
Yeah, so it's 24 hours after they're fever-free or symptoms are starting to improve, and then they have to mask for 5 days, I believe.
Right, but we don't impose the 5 days, but even for healthcare workers, is that correct?
If we know, then people are masking up for those days. We might not know.
And we're taking the employee's word for it, correct?
Yes, I think in some cases, Anne, can you speak to that more? I don't think we've been requiring them to show a test that they're positive. But we are, if you knowingly have been positive and your symptoms improve to return to work, you've got to wear a mask for the required time period.
The nurses are pretty conscientious of the
I would
patients
hope
that they're
so.
working with. Anyone who has a respiratory illness in our area has been would mask without even knowing that they had or even knowing that they didn't have COVID, just to be safe. So if they have a respiratory issue that they're worried about, they're masking.
Okay,
and without being asked to do so.
And also, I know we had a small conversation about our point of care testing. That's where we're doing rapid respiratory testing. So another reason to be both protected, because people are coming to us to get tested. They don't know if they have RSV or COVID or flu.
Yeah.
Very good. Does any board member wish to review this policy in more depth, or if it's our intent to leave the language as is, we have no further action on behalf of the board. If anybody wants to amend it against staff's recommendations, speak up. Okay. We'll stay as it is. Thank you. Item 11, information and communications. And the appendix. I just wanted to point out there's a very good document on the strategic plan update in here, plus all the statistics from environmental health, public health and nursing, and veterinary public health, and community health. It's all got their reports in here. Any questions on any of that?
I don't have a question on that, so I don't want to, if somebody else has a question on that, mine's way off topic.
Go ahead.
We had a conversation when we were doing some of our audits. Where does that stand? Are we still working with our auditor on some internal audits? And if we are, where are we with that? I thought they indicated they were still going to be doing some follow-up with us.
I haven't had any additional communication with them. I mean, we're still implementing many of the recommendations. I can happily check in with them, but they have not asked for anything from me specifically. But we are continuing to implement their recommendations.
I leave that in your hands. I thought they had talked about doing something.
Yeah,
again. I don't know if it was a year later. Okay.
Yeah, sure.
Thank you.
Next item is item 13, enter executive session to review the minutes from the previous executive sessions.
I'll make a motion to enter executive session.
Second.
Who second? I'm sorry.
Or the other Cindy.
Yeah, there was a
Cindy too. Cindy 2.0.
A motion has been made by Ms. Althoff, second by Ms. Gaffney, to enter executive session. All those in favor say aye.
Aye.
Opposed say nay. Motion carries. We will enter
Thank you.
executive session at 7:45 p.m. As soon as you're ready, let me know.
Yeah, I'm ready. I know she's ready.
What?
I said.
She's ready.
I said, I'm ready. I don't know.
Darlene has to get the,
Oh, she's got okay. No problem.
do that stuff.
Yeah. Oh, well, I forgot to mention, so the Defenders are doing a repair fair. So if you know anybody who needs stuff repaired, clothes, bikes, small appliances, it's going to be at MCC in April. It's free, and we're also looking for, anyone